my name is Laura and this is my first video. What I want to talk about is type 1 diabetes and dealing with it when you're a teenager, which I have been through. I am a sufferer of type 1 diabetes myself. I'm 18 now. I was diagnosed when I was 14. And in these videos I just want to cover how to deal with your disease when you're a teenager, because being a teenager is pretty crap anyway, because you've got to deal with stressful exams, bitchiness, boys, hormones. Puberty in general is a pretty shocking stage in your life. Your teen years are probably the most stressful years of your life. So yeah, having an added bonus of a disease is fantastic. So what I want to talk about is just dealing with it, accepting it, controlling it, understanding it. In this video specifically, I actually want to target my story, so my diagnosis, how I've dealt with this disease, how it's changed my life, and things like that. So I'll get stuck right in. My diagnosis couldn't really have come at a worse time during the year, because I had been preparing for a gymnastics and dance evening for a very long time. It was 6 months or more than that, and I was really looking forward to it. I really enjoy dancing, I really enjoy gymnastics, and I was super excited. So to be told that I had to rest by my doctor because my crazy high sugar levels needed to be brought down to a safe level, it was soul crushing. It was utterly soul crushing. I couldn't take part in the show that I'd been looking forward to for months. And it was even worse because there was a really cute boy involved that I really fancied, and I was hoping that something would happen between us during that gym and dance week, so damn it. It was difficult dealing with the diagnosis. I went to watch the gym and dance evening that I couldn't take part in because I wanted to support my friends, and they actually dedicated one of the dances to me, which was super nice, so yay. And I got to talk to the cute boy that I really fancied, and it was a great chat, so yay for that. Dealing with this disease was difficult. The first couple of years were the worst years of my life. I'm not going to sugarcoat it. They were awful. I hated myself. I hated the fact that I had to inject myself 4 times a day, that I had to test my sugar levels 4 times a day. I didn't want to do it. And I certainly did not want to deal with this for the rest of my life. Because as you know, if you're a type 1 diabetic like myself, you can't get rid of this disease. You can't cure it. You've got it for life. And just hearing that was devastating. I didn't want this disease. I wanted nothing to do with it. Like, why the hell did I have to deal with this for the rest of my life? I hated it. I utterly hated it. And, you know, when you're a teenager, it's difficult enough trying to accept who you are. So how the hell was I going to accept this disease when I couldn't even accept who I was? Because when you're a teenager, you're going through your rebellious phase, you're bitchy, you're angry. Having to deal with this disease when you're going through all of that stress is... it's an experience. But what I want to tell you is that it's not the end of the world. You are yourself. Diabetes should not change that. You are your own person. Just because you have to do insulin injections and, you know, closely monitor your sugar levels and change your diet slightly, it doesn't mean that you're a crazy different Martian, you know? You're yourself, and diabetes should not change that. I had trouble accepting that at first because I was incredibly insecure. I didn't want anybody to know that I was diabetic. I didn't tell anyone really, apart from my close friends. And I actually talked to somebody that I hadn't seen in years who went to my school the other day, and they had no idea I was diabetic. And they found out when I talked to them, they're like, what, you were diabetic? I didn't even know that. To have people not know it shows how much I didn't want people to know. You will accept it. You will learn to embrace it, okay? You'll learn to control it, to understand what it's about. It is a sucky disease, you know? You have it for the rest of your life, but you shouldn't look at the flaws in yourself. You should look at the positives of your life. For instance, I love my family. I love my friends. I'm going to uni next year, which is incredible. I got into university. I'm going to Australia in a couple of months as well. That's pretty amazing. And you know what? I love my life. I know it may sound slightly arrogant, but I love my life. I'm my own person, and diabetes doesn't shape who I am, basically. And I just want to help you learn that. So I'm also going to show you some medication if you're somebody watching this who isn't diabetic and is just curious. So we have these blood testers. The one that I use is a snazzy touchscreen one, and it's called Freestyle Insulinx, or Insulin-X, I don't really know, but that's what the monitor looks like. And then I have like the little finger pricker, which is this thing. And then I have test strips, which go into the monitor, and that's what I bleed onto. So that's what I have to do 4 times a day. And then I've got my insulin injection, which is just a pen, and it looks like that. There's no needle on it at the moment, obviously. So it looks like that. It's not too long a needle, which is nice. I have to do it 4 times a day. And one of those injections is my nighttime injection, which is a completely different needle, which I would show you, but I'm lazy and it's on the other side of my room, so haha. So that's my medication, which, you know, isn't that horrendous compared to a lot of diseases, so I guess I'm grateful for that. Right, so I'm going to round this video off now because I've been rambling for quite a while. If you want to check out my blog, I'll put it in the down bar below, and that's just basically what I'll be covering these videos, but in a written form, and I'll probably cover more in the blog actually. So, you know, if you are more of a blog reader than a video watcher, then go and check it out. If you're watching this and you're a teenage diabetic and you want to ask any questions, please leave a comment, because it would really help me. Because as much as I've planned all these videos and I've planned things that I want to talk about, there are things that I'm going to miss out that I'm probably not going to cover, so just tell me what you want to talk about, because that helps. Right, I'm gonna go. It's been lovely chatting to you. Bye bye!